Hi, Miss O'Donnell. If you have a few minutes, I would like to talk with you.
Yes, I do.
In light of the recent Ebola outbreak, I would like to discuss with you my concern regarding disaster preparedness in healthcare organizations, specifically looking at frontline nurses need to be prepared. Being a nurse, you know the importance of personal protective equipment. It is the first line of defense nurses have in preventing them from exposure. Although nurses use PPE on a daily basis, it became apparent that many frontline nurses, as well as emergency room nurses, were not comfortable or proficient in the use of PPE. This was only complicated by the CDC continually changing those guidelines in the care of the Ebola patient. While it is well known that hospital-acquired conditions affect over 1.7 million patients, I think we, as a nursing profession, should ensure these infections are not related to transmission due to our lack of protection. Additionally, OSHA has reported in 2012 that the improper use of personal protective equipment was one of the top 10 reasons for citations given to healthcare organizations. Knowing that frontline nurses are at risk, we must ensure that the most rigorous safety protocols are in place. With the development of evidence-based checklists that include education, training, and proper equipment, healthcare organizations can develop policies around proper personal protective equipment use. Secondly, many think nurses are innate with the knowledge of how, when, and where to use personal protective equipment. However, research has shown us that those nurses, if they're not using those on a daily basis, it becomes difficult in a stressful situation for them to remember the proper use of PPE. Therefore, it is essential for the development of universal protective equipment training that includes exercising or acting out these procedures, which include the donning and doffing of PPE correctly. And lastly, there must be an evaluation of this education and training, both internally and externally. Internal evaluation could include a debrief, which would identify needs for improvement or additional training. External evaluation could be produced by a state health department agency when they come in to do regulatory compliance evaluations. Therefore, as the president of the Texas Nurses Association, I would like to know what your thoughts are on this proposal and what you would suggest in order to move this forward as a state regulation.
The concerns you have brought me are important. Let me do some research and I will get back in touch with you.
Thanks for your time.
Thank you.